Good morning, Nurse.org. It is 4:30 in the morning, Tuesday, February 7th. Let's get started with Nurse Takeover. This is your Cardiac Nurse Practitioner, Shawny. We are in for a day. We have a full schedule, so let's get started. Good morning, Nurse.org. This is Shawny, your Cardiac Nurse Practitioner. It is very early in the morning. I've just gotten out the shower, so we're going to get dressed with me right now as I'm preparing to go see my first patient this morning. So again, I am a Cardiac Nurse Practitioner. I have been a nurse for 23 years. I've been a Cardiac Nurse Practitioner for the last 3 years, but prior to that, I worked in the emergency trauma medicine. So how did I get into nursing? I actually wanted to go pre-med. I saw my youngest sister being born, and that was the most spectacular thing. I was about 14 years old when my parents allowed me into the birthing room, and I saw my youngest sister being born. And I was like, you know what? I want to be an OBGYN. So after graduating high school, I went to Southern University, my alma mater in Baton Rouge, Louisiana, and went to try to dream of becoming a physician. So I enrolled in all of the courses that I needed to enroll in. And unfortunately, in my second year of undergraduate school, I ended up getting pregnant. Not unfortunate, but I mean, that's not the dream that I had for myself. But it wasn't until I became a patient myself when I realized that sometimes the physicians, the ones that were taking care of me at least, were not providing me the absolute best treatment that I think I should have had. So it wasn't until I was delivering my daughter where the nurse that was taking care of me, I'll never forget her name, Carmen, if you're out there, this is about 26 years ago. If you're out there and you remember me, gosh, Lee, you were the one that changed my mind and changed my life into becoming a nurse. So that's what I did. And I have no regrets of becoming a nurse versus a physician. So with that being said, I worked as an LPN in Louisiana. Once I finished my LPN, 2 years later, I got into the RN program. And from the RN program, I decided I still wanted to be a clinician. And so I enrolled in a MP program. From my MP program, I still wanted more, right? So I went back and got another certificate. So right now I am a board certified FNP family nurse practitioner, and I'm working on my certification for my adult gerontology acute care nurse practitioner, and I'm also board certified as a cardiovascular nurse practitioner. So 3 certifications right there. Why? Because I love medicine. This is what I've always wanted to do. I've always wanted to be a clinician for a very long period of time. So with that being said, I landed my job, my dream job, I think, as a cardiovascular nurse. So I'm going to go on and get dressed. I've already started working on some stuff. So I'm going to go ahead and get dressed, and we're going to do hospital first. We have a few consults in the hospital, so we'll take care of those first, and then I am going to head over to the clinic all before 8 a.m. So right now it is 5:30, so I'm going to head to the hospital by 6:30, I'm hoping. And then we'll see our patients, and we'll head over to outpatient. So pretty busy morning right now. Again, I chose this day because the afternoon should be pretty light. That way I can come in and answer any questions, or we can just have general chit chat. Side note, I also teach. I'm an ADN instructor at one of our local colleges here. So tonight we have class, so maybe you can be a part of that as well. So anyway, let me go get dressed so we can start our day, and I'll talk to you soon. Well, good morning again. We finally made it back to the office. How cool is that to see those angiograms, right? So, I try not to have my phone out too much. in respect of the patient, in respect of the physician, my cardiologist that I'm working with, who I do rounds with him at the hospital. But we are in the office. It's about 7:30. But those two angiograms were very, very unique, and I wanted to make sure I got a picture for educational purposes. So one patient, when the physician went in and did that angio, and we saw the aneurysm, all of us were like, so, you stent that, and hopefully that area kind of closes in a little bit, and that patient can get proper perfusion. And like I said, both patients will be on dual antiplatelet therapy, which is typically going to be ticagrelor or Brilinta. We put them on clopidogrel or Plavix or even. So our schedule is looking pretty good. This morning we have about 15 patients, and it's just me here in the office all day. So 15 patients this morning and 15 this afternoon. Oh, we have a stress test. We have our pacemaker. Today is our pacemaker. And let's see. So we've got ultrasounds here today. Our schedule is pretty busy here. So this is what we get to look at. So we've got pacemakers that come in. We've got our ultrasounds, our follow-ups. It's pretty busy. We've got a stress test. So hopefully I'll be able to show you guys some good things, a lot of things that I do here. These were the procedures that we did this morning. With that, we're just going to get started. So typically what I do when I get in, I go over my charts. I try to complete any previous notes that I didn't get to complete the night before. So then I go through my folders as well. I've got folders over here for my surgical clearances, my medication, refill prescriptions, EKG review. I've got urgent messages there. And in addition to these, I also have an emailing system here and a text message system that I use with my medical assistants and my cardiologist. So I work with 4 medical assistants, 1 cardiologist. It's just me and the cardiologist. It's primarily me here 4 days out of the week. My cardiologist comes in with me 1 day out of the week. And then I get to pick his brain, which is kind of nice. So today we're going to get started. I just received the message. Would I like to do my telemedicines? Absolutely. Let's get started. Here is my telemedicine bunch. So these are all the patients that I'll be talking to over the phone. I use a headphone system that I absolutely love. And then we go see patients in the office.
I don't even know if I can do that at this
Yes, you
okay,
can. Yeah. Right. Okay. So this is what kind of machine is this?
So this is our Boston Scientific pacemaker interrogator.
Okay.
And this is an ICD platform that we have right here at this time.
And what do we use this for? What type of patients?
So for ICDs, we use it for patients with cardiogenic shock and non-ischemic and ischemic cardiomyopathies.
Okay. Okay, so can you tell me a little bit about this probe?
So we call this the wand.
Okay.
And the wand allows us to be able to talk to the pacemakers and make whatever adjustments that we can. So normally we would put that right here on the chest where the pacemaker is located. And then from there, it would be able to download all the information onto our interrogator.
Awesome. Thank you. So I have one more telemedicine consult for the morning, and then I'm going to come on and answer some questions. Good morning. This is Shawny, Nurse Practitioner. Good morning. Hi, how are you? The morning is complete. Well, I have one 10:45 that has not showed up yet. It's 10:54. So if they don't show up, we no-show them. So out of 15 patients, 12 have shown up. So we've already done our pacemaker. We've already had 2 treadmill EKGs. I did try to capture as much as I possibly could. And let's get into answering some questions. So you want to be a cardiac nurse and you're graduating soon? Congratulations to you. One of my recommendations is learn your EKGs. That is something that I look at on a daily basis. That is something that you're going to need on the telemetry unit or if you're working in cardiovascular ICU. So my number 1 tip is get an EKG book that will help you to learn your basic rhythms, your basic patterns, how to identify if a patient patient is in distress. Another tool that I would recommend is knowing how to do your cardiac assessment. Your cardiac assessment is going to be different from your med-surg assessment. So there are books out there, there are online programs that you can take to be able to enhance your skills. Again, congratulations, and I hope to work with you soon in cardiology. So this is a really good question. Cardiovascular ICU versus telemetry. Well, it just depends on how much exposure you want. With cardiovascular ICU, you're exposed to the ECMO machine, you're exposed to drips, you're exposed to the cath lab experience, or being part of that cath lab team, and you're reading EKGs on a constant, and you're doing more focused ICU care for your patient. Not to negate telemetry. Telemetry nurses do the same, similar, but they're not exposed to the ECMO machine. They're not exposed to drips. And so depend on what your outcome is. Your goal is to become a nurse practitioner. If you want to go into cardiac nurse practitioner, I think the CV-ICU route would be a little bit more focused, because then now you're specializing in just cardiac. With the telemetry nurse, you have a mixture of med-surg nursing, and so you have a broader range. So the difference is your nurse practitioner, we are advanced practice registered nurses that are able to practice medicine such as a physician would. So we are able to diagnose, treat, and prescribe medication just like your physician would. A registered nurse is just a nurse who focuses on direct patient care. So some registered nurses have a master's degree, but they do not have the advanced training like a nurse practitioner would. For nurse practitioners, we have an advanced training in whatever field we choose. So women's health, family medicine, adult gerontology, pediatrics, neonatology, certified nurse anesthetist, and acute care. So we go beyond the master's and the doctoral degrees to be able to get the extra training so that we're able to practice medicine such as a physician would. So that would be the difference between the two. Absolutely. You already have an advantage. You work cardiac. The difference between you and I is you work on little people while I work on big people. So the one thing that I really love about being a nurse practitioner is we're not tied to one specialty. We can work and rotate in any specialty that we would like. So your advantage is that you already have cardiac ICU background. When you go and become a nurse practitioner, you can focus on family medicine, which will allow you to work with children and up to adults. And if you wanted to specialize in cardiac and you want to, take a opportunity and work with adults, you don't like it, you can go back and work with pediatrics as a cardiac nurse practitioner. So absolutely, I think you would be a great candidate considering you already have leverage and the advantage. I know this book is backwards, but it's the Rapid Interpretation of EKG. My cardiologist actually recommended this book, and when I told him, I already have this book. This is old. I've been reading this, or I've had it when I was working in the emergency department. So this is a very, very good book. You can find this on Amazon to learn how to just get the basics of the EKG. I would definitely say when it comes to interpreting, practice makes perfect. You have to see 100 EKGs every day in order to be at least competent, let alone proficient. So the more you see it, the more you'll be able to interpret it, the more advanced you become. And when I don't know, I ask the big guy. I ask the cardiologist, and he's there to guide me. So hope that helps. So one of the best perks I love about working in the office is you always get free lunch. That's Chinese food, okay? But your favorite drug rep comes in. Your favorite drug rep comes in and brings you lunch. Well, not just me, but she brings the entire staff. So this is my favorite. When I tell you, it's such an understatement, but this is like my favorite drug rep. She is with Eliquis. So Eliquis is one of the drugs that we use for patients who have atrial fibrillation, and we want to make sure they prevent any clots in their heart. But we use it for DVTs. We use it for PEs. And she's my girl. Yay! And she came and brought lunch for the entire staff. So it was her day, though. But I'm so glad she's here. So I'm going to chit chat. So when it comes to mentors for the RN program or for registered nurses, I would definitely say reach out to your local hospital. Your local hospitals have a preceptorship in certain specialties, and nurses sign up for preceptors to become a preceptor or a mentor. So if you're interested in a particular specialty, I would definitely say reach out to your hospital and find out if they have any preceptorships available for whatever specialty you're looking into, and then they will assign you a preceptor or a mentor. So hopefully that helps for your RN. In my humble opinion, I feel like the best letter of recommendation would be from one of your colleagues. So your charge nurse, if you're close to them, maybe your nurse manager, or even one of your registered nurse colleague, peer, who knows your work ethic. They know how well you're able to handle stressful situations when it comes to patients or family members. So I think that would be the best letter of recommendation. It is from your job. It is credible. They will be able to provide valuable information pertaining to your work ethic, and how you would be able to perform as a registered nurse at any entity. So in my opinion, if I had to get a letter of recommendation, it would be from someone that I'm working side by side with. This is a good statement here. So there are two types of board certified nurse practitioners. You can either have AANP or ANCC. I personally have both. That's how I have 2 out of the 3 certifications for me. So with those, it all depends on really how you want your name to read. So with this, if I am AANP, my letters say FNP-C. If I have ANCC certification, that my credentials will say FNP-BC. They're both board certified. It really just depends on how you want to take your test. For AANP, they're basically going to be more on clinical and theory, multiple choice questions, versus ANCC, you have choose all that apply, you have diagrams, pictures. And so ANCC focuses more on clinical practice, whereas AANP focuses more on theory. So again, it just really depends on how you want your name to read. At the end of the day, as long as you have one and you're board certified, that's really all that matters. Now, when it comes to your state, each state has its own nurse practitioner organization. So it gives you your what's going on within the state. So for instance, California, we are newly with our AB 890 for autonomy in practice, meaning that now since 2020, we don't have to have a supervising physician. We can actually practice medicine without having a supervisor position. So that gives us full autonomy, which is good. So for us, nurse practitioners, it's good to be a part of your organization so that you know what's going on in your state. And that's all I'm going to say about that when it comes to the variances between the 3. So AANP, ANCC certification, your nurse practitioner organization, there is no certifications. However, if you're looking for preceptors, if you're looking for educational, dinners, things like that, wanting to know what's going on within your state, follow your state organization. A patient who has a cardiac life vest on. I went and got consent from him to show the life vest. So I want to show you something really cool with him. So let's go see. These are patients who are need a defibrillator, but they don't have a defibrillator at the time. So this is a external defibrillator. We call it a life vest. You put them pads on them just like you would if you were putting on an EKG. But what it does is, if in fact a patient is going into ventricular fibrillation or regular heartbeat, what the life vest does is it will charge like you would an external defibrillator on, and it will give a couple of sounds to notify the patient that you are in an irregular heartbeat, and it will shock the patient. And so we typically will put a defibrillator on a patient, a life vest on a patient if they are waiting for a ICD pacemaker, right? So again, these patients are discharged from the hospital. This is my patient that we're following up on, that is discharged from the hospital, and we will place that life vest on them if they're waiting for an ICD pacemaker. So that is him showing us that he actually came in still in the clinic with his life vest on. So now we refer him out to EP for consultation. If you're an auditory visual learner like I am, I had to record my lectures and listen to them over and over and over to retain the information. So one of the things that I also did was I purchased this book. This is a review book. I have one for family and for adult gerontology. It is the Bible. It is the saving grace. It provides all of the information that you need in order to be able to pass your boards. The third thing that I did was I purchased an online review course that kind of guided me in order to be able to retain all the information as well. So for me, auditory, visual, repetitive learning, the Bible, all of those helped me to retain the information. I took both certifications. I passed on the first attempt. I think if you're just like me, you're going to do just well. Good luck. We are now at the end of our Instagram takeover. Thank you so much, Nurse.org, for allowing me to take over your Instagram stories, showcasing myself as a cardiac nurse practitioner from inpatient to outpatient. Follow me on Instagram and TikTok at shawny.the.mp. I hope you have a great evening. Take care.